Thank you, Chairman Johnson, and thank you, Secretary Shinseki, for being here today and bringing your very able team to appear before us. And let me say, from my perspective, I very much appreciate your many years of service, both in and out of uniform. And I also appreciate the time you took to spend with me talking through New Mexico veterans issues and veterans around the country. New Mexico is a very rural state, and as you're aware from our discussions, in rural New Mexico as well as rural areas throughout the country, it can be very difficult to recruit doctors and nurses and staff to serve in rural clinics, including VA clinics. What is the VA currently doing, and how will this budget support the recruiting and retention of qualified personnel to serve at rural VA clinics?
Let me call on Dr. Petzel about the recruiting and retention efforts.
Thank you, Mr. Secretary. Senator Udall, you put your finger on an issue that is important to us, and that is being able to provide medical care in rural America. 40% of our veteran population lives in rural or highly rural areas. And there's a cascade of things that we do. Let me just quickly go through them. Well, number one, we have community-based outpatient clinics, 121 of those clinics around the country. We have the vet centers, which are scattered into some very rural areas, and the mobile vet centers, 70 of them that can go out to other areas. The largest growing way that we do this is telehealth, and I am getting at the recruitment. We are the largest purveyor of telehealth in the country, and we are now setting up separate individual telehealth clinics where we have a clinical professional, perhaps not a physician, at a site where patients can come in and be connected to their provider by a telehealth, would be it primary care or specialty care. Began in Colorado and now has spread across the country. And it's one of the things that we're going to be using in New Mexico to help us supplement the care that we're delivering in rural America. In terms of recruitment,
Dr. Petzel, let me stop you there. So even for primary care, you're using telehealth?
We can, yes, sir.
And are you, when you do that, have you taken a reading of a satisfaction of vets with doing telehealth for primary care? I mean, I'm wondering from a perspective of seeing that most people like to meet with their doctor in person. And I can understand, and I think everybody can, the telehealth for specialists and things like that. But as you do that, I think it's very important that you try to take the temperature of veterans in terms of how they feel about, not ever seeing an actual doctor in person. And that's the thrust of this question of mine, because when you see the clinics, and at least New Mexico, and I'll bet this is across the country, what happens is you'll have big gaps. They'll lose a doc, and then it'll be 18 months or 2 years before you're able to get another doctor. And so if you can fill it with telehealth, that's fine, and have a good satisfaction level. But the thrust of my question is really going to the recruitment of docs into these areas. And maybe the mobile option you're talking about is a good one too, where I know the reality is many of these doctors and other professionals don't want to live in these rural areas, and so it's very hard to get them there. And you may want to try to team up with the medical schools. I mean, we have a big problem in New Mexico because our medical school, on the day of graduation, we invest all of this, the state of New Mexico puts in money, 75% of our graduates leave the state on that day of graduation. And so we're trying to work with them to see how do we keep the people there, and then how do we also get them in rural areas. Please go ahead.
Senator, just a quick word about the telehealth clinics. The patients love it. They like it because, number one, there is a clinician there. There's a clinical person, usually an RN, but they don't have to drive 80 miles or 100 miles to see their doctor. They can see this person face-to-face. Many of the things that you would do in a visit face-to-face are done Blood pressure is transmitted electronically, EKG, et cetera. So the satisfaction levels are higher than we see in our clinics. Now, just briefly about recruitment. Salary is an important thing. We have tremendous flexibility in terms of salary. Providing the support around that physician is important, and we can do that. We don't have any more difficulty generally recruiting into highly rural areas than the communities do. It's just a very difficult task to get people who haven't lived in a small town to come to a small town, and their wives have some influence on doing that too. We are looking at scholarships to individuals where we select people that come from rural communities, provide them with support while they go through medical school, and they they have an obligation then to us for a period of 3 or 4 years, depending on how long we've been providing them scholarship, to go back to a rural community. I think that's going to be very effective. And your medical school in New Mexico, I think, is doing some of those similar things.
Yeah, no, they are. They are. Just quickly, my second question was about the travel. That veterans, many times in New Mexico, they have to travel 5 and 6 hours to get to the VA center in Albuquerque, sometimes spend the night and then come back, and it takes a person from the family or others to take time to drive them when they're older. I assume telehealth is some of the answer there, but part of my question is to ask about what this budget does to increase transportation options for vets in terms of trying to travel up to get specialized care in these centers.
Thank you. That is an excellent question. The budget has in it money for the Veterans Transportation Network, which is a network that the VA is setting up to provide transportation services in these rural areas. And in addition to that, there's a second element, and that's grants to other organizations, usually service organizations, to provide transportation for veterans. So there's a substantial, I have to get back to you with the exact amount, there's a substantial amount of money in there to provide transportation services in these rural areas.
Good. I hope you'll do that. Thank you very much.